I started doing oral appliance therapy in 2014, and I realized pretty quickly how big this was and how many patients really truly are out there that are going untreated for sleep apnea because of their intolerance to the CPAP machine. And so we started Sleep Better Austin as its own entity to really care for those patients that have sleep apnea and specifically either don't want or can't tolerate the CPAP machine. One of the benefits to the Respire Pink AT device mechanism of titration is that you don't have that barrel on the side. Well, I think sometimes what we ran into with some of these old devices is the little barrels would unscrew on their own. You know, while the patient's wearing it, they might be bruxing a little, and as these barrels would unscrew, they would kind of slip, and so they would lose their position. So we would advance them, you know, maybe 2 millimeters, but then a week or two later, it will have unscrewed maybe 0.5 millimeter on one side, throwing off things. Now that we have this mechanism where you're coming in from the back of the device and the back of that hinge, we don't see that slipping. Once you advance it, it kind of locks it in place so that you don't have that slippage that you might have had with these other devices that we've used in the past. There's a couple situations where having a little bit more protrusion ability helps and makes sense. First, it allows us to be a little bit more conservative. So if we have patients who maybe have some previous TMJ symptoms or we're concerned about advancing too far too fast, we can start in a little bit more of a conservative position and not have them. We might be able to start at 40% protrusion instead of 50 or 60% protrusion. In addition to that, sometimes you're getting patients to where you get maxed out and you can't advance the device anymore. You've reached the end of that titration. And if that happens, you have to take the device back from the patient, send it back to the lab. So you're taking away therapy from the patient. It takes a couple of weeks to send it back to the lab, get it reset, and then send it back to you before you can start wearing it and advancing again. This Respire Pink AT device can go 7 millimeters, so that's really nice because we can get a little bit more out of it without having to reset it. With this coronavirus pandemic that's going on, we're doing more telemedicine visits with our patients, some of our patients that are worried about coming to the office. I think that one of the benefits to this device is it's a little easier to demonstrate how to make these advancements with patients. This new key for the Respire Pink AT device is really easy to use. It's got a nice large handle, so it's easy to hold as opposed to some of these kind of Allen wrench type things that we've used in the past. A lot of with the older devices and the little barrel that you have to stick the key in and turn it multiple times and take the key out and put it in, and you know, you can only do these quarter turns with it. This new key for the Respire Pink AT device, you don't have to take it in and out to make the advancements, which makes it a little easier for the patients. And you can get to 1 millimeter of advancement with only 4 turns as opposed to the 16 turns we have to, you know, quarter turns that we used to have to do before. In addition to that, it has a scale. So as you advance, you can see how far each side is advanced. Many times in the past, I have patients that turn one side the wrong way and one side will be protruding and the other side will be retruding. And it ends up making it all kind of cattywampus and throws off the patient's jaw and their bite, and then they get pain and all these types of things. And so with this, it's just easier to look at it and see that we're doing it evenly on both sides. I'm really excited to see what this can do for our practice, and I'm excited to see what it can do for our patients.